Hey guys, it's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today we're going to be chatting a little bit about vaccines so we can get you some more information. My assistant Maddie is going to be asking me some questions, and hopefully this can help educate you on vaccines and why they're so important.
Dr. Denney, what exactly are dog vaccines?
So vaccines are injections that we can give to stimulate the immune system. So if your dog or cat comes into contact with an infectious disease that is treatable and preventable, that vaccine is going to give the immune system a leg up. So when it sees or it comes into contact with this infectious agent, the immune system can mount a much faster immune response and sometimes create the fact that the dog will have no symptoms. Sometimes they will, but the reason we have vaccines is so we have a less severe, shorter course of disease or no disease at all.
Are vaccines required by law?
So the rabies vaccine is required by Texas state law. It is a yearly vaccine unless you get it done once the dog is an adult and you get a vaccine, the rabies, and then you get it boosted within a year. That vaccine will then turn into a 3-year vaccine. But yes, rabies is required by law.
How soon should I get my dog vaccinated?
So I like to start puppy vaccines between 7 and 8 weeks of age. The reason I like to start at this time period is that the mother's maternal antibodies, so that's the prevention or that's the protection you get from your mother, like when you're drinking the milk. It's called colostrum. Those antibodies circulate in your body and they help protect you, but they only last, around 6 to 7 weeks. And so I like to start vaccinating when they're starting to go down, so we can start to stimulate that immune system. When vaccines are given really early, sometimes the maternal antibodies will latch on to the vaccine because it recognizes it as potential disease and it deactivates your vaccine. So for me, whenever I see puppies that have been vaccinated at 4 or 5 weeks, then I pretty much think that the vaccine was probably deactivated from the maternal antibodies.
Do I really need to avoid allowing my puppy to socialize with other dogs until they are fully vaccinated?
This is actually a really good question. We want to protect our dogs from risk, but we also need to hit that socialization window, which is where the puppy learns things and is exposed to things that we don't have a terrified, nervous dog when we get older, which can be much worse to handle and a lot more problems later in life. So we have to mitigate the risk. So I like people to take your dog to places, but I don't want them around high dog traffic areas. Don't take them to PetSmart. Don't go to dog parks. If you want to go for a walk around the block, try to keep them on the concrete. If they are going to be greeting other dogs, ask the owners, hey, is your dog up to date on vaccines? We're mitigating risks. So we still want to have these experiences, but we don't want to go throw an unvaccinated or not fully vaccinated puppy into a dog park where we know, Joe Schmo maybe have never had vaccines, and then your dog ends up with parvo a week later. And parvo is a deadly, deadly, deadly infection.
Does my dog's lifestyle factor into what vaccinations my veterinarian will recommend?
It's a really great question. 100% that matters. For instance, we don't have a ton of Lyme disease down here. We can see it sometimes. For dogs that are mainly indoor, that aren't going out into a bunch of woods, that are on flea and tick prevention, we don't do a lot of Lyme vaccines. For dogs that are traveling to Colorado or going up into the mountains or into high tick endemic areas like up north New York, Maine, Maryland, then the Lyme vaccine is going to be much more important. Canine influenza is another example. That one seems to kind of go in waves across the United States. So when we're not having an active wave, we don't always recommend it. It's something that you can get. Boarding facilities sometimes will require it, but it does depend on kind of where you live and what's endemic to your area. Here we have a lot of leptospirosis. Leptospirosis is a bacterium that attacks the liver and the kidneys, and it can also be transmissible to humans, and it's in standing waters transmitted by wildlife urine. And with all the rain we have, we're a high-risk area. So I 100% recommend lepto vaccine for all of my canine patients. I don't care if you're just going on a leash walk around the block, you're still getting exposed.
What are the typical puppy and dog vaccine schedules?
So we talked about it a little bit, but typically you want to vaccinate every 3 to 4 weeks up until 16 weeks of age, and then it's once a year thereafter, depending on your vaccine. Like we said with the rabies, there are ways to get into a 3-year vaccine. The distemper parvo can also turn into a 3-year vaccine. So you can talk to either us when you call or at your annual exam. We can chat a little more about that. But vaccines are super important. We have some people that don't like vaccines, that don't believe in over vaccinating, and I really don't believe in over vaccinating either, but I also believe in preventing diseases that are preventable, like deadly diseases that are preventable. So, you know, we have some clientele here whose dogs are extremely immune compromised or are unable to get the vaccine, so they rely on herd health. So if you've, you know, been paying attention the past 3 years about COVID-19, you're going to understand what herd health is. These are people that have immunity, so it's less likely to spread the disease. So the dogs that don't have vaccines are relying on every dog that they come into contact with having been vaccinated so that they're protected.
What diseases are prevented with vaccines?
So we chatted a little bit about this, but we'll touch on it again. Distemper, parvolepto, parvovirus, bordetella is a common one that we can see in canine influenza, Lyme. There's even vaccines for rattlesnakes. So the vaccine helps you buy time. It's not a prevention and it's not a treatment for a rattlesnake bite, but it does buy you time to get to a veterinarian.